Hi everyone, good afternoon. My name is Dr. Singh. On this third episode here at Holistic Healing Arts, I'm going to be interviewing one of my colleagues, Dr. Mary-Leah Albano, and today we're going to talk about detox, a very popular topic, as you know, Mary-Leah. But before we actually get into the detox, let's start by asking you, how long have you been in practice as a licensed ND? And the other thing I want you to sort of get into is what inspired you to pursue this path.
I'm in my 7th year of practice, believe it or not, and I was in school for public health, getting my master's in public health, and it really exposed me to a preventative way of looking at our health. So instead of waiting until we have symptoms or a disease state has occurred, is trying to take control earlier on, so changing habits. And I was fascinated with natural medicine and natural health, even growing up in high school. And so when I found out that there was actually a naturopathic program, becoming a doctor, that you could help people using Mother Nature natural means in a preventative way, it made sense to me. And then that led me to come to Toronto and do my naturopathic degree.
Wonderful. I didn't realize it's already been 7 years.
Yes,
yeah,
I know.
Wow.
I know.
So today's topic is going to be detox, and I realize this is such a broad topic, and we just want to sort of touch on some of the key points. Let's start by asking you, in your opinion, what are some reasons for doing a detox?
Detoxes, yeah, you're right, are very popular nowadays, and there's lots of different reasons to do one. Even simply if someone is just feeling kind of fatigued and not themselves and just wants to almost have like a reset to their system, I find detoxes come in different forms, which we'll talk about, and those would be reasons to do it. If digestion is a little bit off, don't feel like you're really digesting well, you have to be careful with doing detoxes during that time, but they can really help to kind of get the system back on track. Another one would be even just mentally, like feeling like you're just a little, like you need a bit of a pick-me-up, and you can have some positive mental effects when you do a detox as well. And I'd say the last reason, there's many reasons, but a popular one would be even hormonally. And I work a lot with females, so female health-wise, if we're seeing that maybe the cycle has changed a little bit, or there's lots of PMS symptoms, maybe resetting the hormones as well with doing a detox and detoxifying the body.
So you've used this word reset a few times.
Yes.
So I think I find that very interesting as well, because when patients come to see us, if they have a broad spectrum of different symptoms going on, and you've actually given some examples of that, and let's say they've tried different things, or you've worked with them and tried different protocols, and we're still kind of at that standstill, then resetting sort of the physiology through an appropriate detox, I think, is what you're getting at as well. And some of these like broad symptoms that could point to the need of doing a detox could range from digestive issues, gas, bloating, as you said, feeling fatigued mentally, not feeling like you're balanced, perhaps some skin issues, and as you said, because your liver is one of your main organs for metabolizing hormones, there's another aspect as well.
Exactly.
How often, this is a question obviously all our patients ask us, and is how often should someone do a detox?
It's a great question, and broad answer is it depends. It really depends on the individual, because we do try to individualize any kind of treatment protocol or detox to the person. But we're talking about this today because it's springtime, and we're finally getting weather that reflects that as well. And spring wouldn't be one of the best times to do a detox. It could be done once a year. It could be done perhaps again in the fall as well. So twice a year. Some people like to do them seasonally, 4 times a year. So it really depends, and that's a conversation worth having with your naturopathic doctor. But best times of year to do it. So just as nature herself is shifting and kind of shedding the winter, then we also kind of want to do that as well. And it doesn't have to be done, but those are probably the best times to do it. So once or twice a year would be a general recommendation.
Yeah, I like how you phrase that, sort of following like nature's transitions as well.
Right.
So kind of like, your car getting the oil change every 6 months,
Yeah.
so twice a year.
Yeah.
Can anyone do a detox?
It isn't recommended for everyone. There are certain populations who should be cautious, and it isn't recommended. So, for example, pregnant women and children. Because we just have to be cautious and careful with stimulating those organs of detoxification. And when I say that, you mentioned one was the liver. Another would be the kidneys, the lungs, the skin, the lymph. So these are all organs in our body that are detoxifying every day. And those populations are sensitive populations, so we have to be very careful. The other would be weaker individuals, or if the immune system is very weak, someone who might be, after an illness or surgery or something like that, then we want to be very careful. So if those aren't at play, then certainly you could discuss doing a detox with men, women of any age, really, watching for those special populations, though.
Okay. So I'm glad you listed those, because that really then also emphasizes that, not just everyone can do a detox. You do need to work with your, naturopathic physician, health practitioner, to make sure that can you even do something more than just a mild detox, right?
Yes.
And I think maybe to add on to that, if someone is on like multiple prescription medications, we also have to be very careful and cautious about how we're going to design, and if we're even going to explore doing a moderate or even sort of a more deeper detox with that individual.
Yes, definitely, and I'm glad you brought that up. Yes.
No problem. There's so many different detox plans out there. Another question that I'm sure you hear as well is, how do you know which one is the right one for you?
That is a great question. And again, I think having the opportunity to sit down and talk that through with patients, I do encourage people to talk to their naturopathic doctor about it. It really depends on where the patient is at and what they want to get out of it. So something as simple as just changing your diet, like drinking more water, for example, would be one type of protocol. And it kind of depends on where you're starting from, or eating less processed foods. And the one element of any protocol that I find very, very important is that diet needs to be adjusted. It definitely needs to be changed. There are some protocols that involve supplementation or herbs or teas or things that get the bowels moving, working on the liver, these sorts of things. And those protocols we have to tailor to the individual. We have to be very careful. But doing those aren't enough. We definitely need to start with the diet. And so there's lots of different things out there. I like the simpler the better. So finding out where someone's at and what their goal is in that detox. So is it just to feel a little bit lighter? Is it for weight loss? Is it for hormonal changes, for skin changes? So then we would tailor it to that person. So if we needed to see a change in skin health, for example, then we might want to do things that are improving blood flow and getting the lymph flowing, or doing exercise to really be getting that blood flowing as well, in sweating. So there's many different protocols, but keeping it simple and diet is definitely a big piece of that.
No, and that's great, and I think that also brings out the point that everyone is indeed an individual. So what you're basically saying, as you said, it depends where the person is in their journey of health.
Right.
That will then determine what type or what you might recommend, and what sort of components will be involved in that detox protocol.
Right. Yes.
Are there any side effects when you do a detox?
Oh, certainly, yes. And so we do have to be careful. Mainly digestive, so we'll usually see the bowels will start to move a little bit more. Now, one concern with doing a detox, before you even do a detox, is you do have to make sure that you are having regular bowel movements. So if there is any constipation before you even start, then we do want to work gently on that digestive tract first to make sure you're eliminating, and then help to support that liver and the kidneys and your organs of detoxification at that point. Increased bowel movement certainly can happen. Sometimes headaches can happen as people start to move. If you're, let's say, getting off of coffee or caffeine for a certain period of time in a detox, that can be pretty shocking to the system. You're so used to it. So headaches can happen. Sometimes we'll see flare-ups of, let's say there is eczema or acne or skin condition. Sometimes things get worse before they get better when doing a detox. So that's something to also watch for as well.
Excellent. Sort of a closing question. If you were to give 2 or 3 simple ideas, I know you've kind of already alluded to them, but for just generally some basic ideas for daily detoxing, nothing too aggressive, what would be your advice?
Definitely more water. I find a lot of people aren't drinking a lot of water in the day.
How much do you recommend for the average adult, let's say?
About 8 cups is what we usually, and that's an average adult size.
And that's just water, right? That doesn't
water.
include like juice or,
Yeah, okay. But a nice warm water with lemon. We usually hear about lemon too being a detoxifier. It does help to stimulate our digestive juices in our liver. So that's something that can be done in the morning, even through the day. Movement, walking. Within people's ability and limits, but that definitely helps to detoxify our lungs and gets us breathing and getting rid of carbon dioxide, taking in good fresh oxygen, and gets our lymph flowing and cleaning our blood. So that would be another thing to do. And even something as simple as adding ginger, for example, like a very herb that we use in cooking. Has a bit of a spiciness to it. Not everyone might like it, but it has a warming effect and improves that circulation as well. Helps with detoxification through the bowels as well. So a few simple things. There's so many different ones, but can definitely help.
Wonderful. Thank you. I think that's some great information. So sort of just to quickly summarize, it sounds like from what you're sharing with us today that generally it is important to do a detox once or twice a year. As you said, with if we kind of find when the seasons are changing, that might be a good time to do it. Everyone is individual, so depending upon your health needs, what your health status is, are you on medications, not on medications, as you work with a health practitioner or a naturopathic doctor, they can help to tailor a program that's unique to you. So thank you. And then in closing, for all of you who are tuning in, next week is Naturopathic Medicine Week. So at our clinic here at Holistic Healing Arts, we have 4 lectures going on next week. And I believe you're also doing a full-fledged lecture on this topic as well, on detox.
Yes, on the Wednesday evening. I'll be talking about detoxification and using natural means.
Perfect. I know there's going to be a lecture on stress management by yours truly. Dr. Mary-Leah Albano will be doing detox. Dr. Burke is going to be talking about breath. That's going to be an interesting one. Dr. Angela Hanlon will be talking about thyroid. So definitely contact our clinic to get more information on those lectures. All are welcome. And once again, I want to thank you for taking the time to sit down with me.
Thank you for having me.
Yes, it was great.